Yeah.
I kind of.
Looks like it works. The work session of the Isabella County Board of Commissioners to order. Stand for the pledge, please.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Clerk, a roll call, please.
That Commissioner Hutchinson,
Here. Here.
Jalzinski.
Here.
Commissioner Marino.
Here.
Commissioner,
Here.
Commissioner,
Here.
Commissioner Horton, I'm sorry. Oh, who did I miss on the? Commissioner Embry.
Sure.
All present, Mr. Chairman.
Now is Mr. Horton.
Thank you. So up next is approval of the agenda. We'll start out with general public comments, and then we have a report from Community Mental Health for Central Michigan. Executive Director Brian Krogman and Isabella Program Director Jen McNally. So welcome. We have no appointments to boards and commissions. Under committee reports, Finance Administration Committee.
Finance Administration Committee is all set, Mr. Chairman.
Thank you. And Criminal Justice and County Affairs Committee.
The Criminal Justice and County Affairs Committee is all set, Mr. Chairman.
And Public Works Committee.
Human Resources and Public Works Committee is fully staffed and all set.
We have no intergovernmental affairs this evening, no administrator controller issues, no unfinished business, no new business. We'll have another opportunity at the end of the meeting for general public comment. So, and then announcements. So with that, is there a motion to approve the agenda?
Mr. Chairman,
Yes, sir.
just a question. I know we have this on the engagement with
Right.
Fisher
Good.
Boys. Is that something that needs to be on the agenda?
Good call. Here it is.
Okay, you found yours.
Yeah.
Sorry, it does need to be added to both the work session and the regular meeting. So if someone could,
Chairperson Hope, I'd like to add to new business, item A, consider approving the engagement letter between Isabella County and Fisher Broyles for legal services.
Support.
Okay, moved and supported to add engagement letter with Fisher Boyles under new business. So with that addition, is there a motion to approve the agenda as amended?
So moved.
Support.
Supported, all those in favor say aye.
Aye.
We have an agenda, and that brings us to general public comment. Is there anyone for general public comment?
Oh, God bless you.
Seeing no one for general public comment, and there will be another opportunity at the end of the meeting. We'll move right along. Presentations and special reports, Community Mental Health for Central Michigan.
All right, good evening, commissioners.
Good evening.
I appreciate the opportunity to spend a little bit of time with you this evening. My name is Brian Krogman. I'm the Executive Director for Community Mental Health for Michigan. And with me is Jen McNally. She's our Program Director for here in Isabella County. You're receiving by handout our most recent annual report. It's from fiscal year 22. Some of the comments that I make will be reflected in the report. But I think the report gives a good representation of really a lot of the community partnering that goes on that we're part of as a public agency. And so we're pleased with all of the various efforts and partnering that goes on. And so Community Mental Health for Central Michigan is a 6-county governmental authority. We're established by the Michigan Mental Health Code, and we are governed by a board of directors. Membership is made up of the respective county commissions. We have community representatives, and we also have individuals who are recipients of services on our board. In all, it's a 14-member board. I'd like to thank Commissioner Hope for his service on our board over the last 6 years. So appreciate that. The counties that we serve in addition to Isabella County include Clare and Gladwin counties, Mecosta and Osceola counties, and Midland County. I'd like to thank you for your strong partnership for the community at Isabella County and the citizens. We provide a wide array of evidence-based services. Children with serious emotional disturbance, adults with serious and persistent mental illness, and individuals with intellectual developmental disabilities. We also serve persons with co-occurring disorders, meaning they have mental illness along with substance use disorders. Our vision is communities where all individuals experience healthy and meaningful lives. MHCM professionals provide individual and group outpatient treatment services, home-based services to support the whole family, psychiatric care, case management services, and really to enable individuals to live in their communities and participate fully. We also provide 24-hour community crisis supports and a host of other services across the continuum of care. Last year, our agency served over 10,700 individuals across those 6 counties. That's an unduplicated count, but at any point in time, we're serving about 5,300 persons, including over 1,200 children. Approximately 2,400 individuals receive services here in Isabella County. Across the 6 counties, CMH funding supports nearly 2,500 jobs, providing services to some of the most vulnerable citizens in our communities. Of those positions, our agency directly employs about 445, 450 staff. About 173 of those staff are here in Isabella County. That includes both our clinicians as well as our administrative staff. So Mount Pleasant houses our administrative staff for the agency. The remainder, about 2,000 part-time and full-time workers are employed by contracted providers. Those working in adult foster care settings or providing staffing to assist individuals to live independently in their own homes and participate in their communities through skill building services, support employment services. Some of these providers include Listening Ear, the McBride Organization, Mid-Michigan Industries. Perhaps those are some organizations that you're familiar with. We are accredited by the Joint Commission. It's a national accrediting body. The Joint Commission is primarily accrediting healthcare organizations. We've held a continual accreditation dating back to 1996. In fact, we've just completed it's a 3-year on-site review process for accreditation, and just I think it was September 13th through the 15th, they were on site reviewing services at each of our locations. So that was just concluded. As in previous years, we have a number of areas of improvements that were identified, and we're working on addressing those. As far as our finances, The budget for fiscal year 24, which we're just embarking on, is $147 million. Most of that, about 93% of that is Medicaid funds. For Isabella County, the budget is about $39 million. Isabella County contributes $216,000. That's a fixed amount that has remained the same since 1997. And that was fixed when we became a mental health authority. And each of the counties within our catchment area has a defined amount. And so that's Isabella County's amount. We have been working on our strategic plan. So historically, we have had a 3-year strategic planning cycle. And so fiscal year 24, 25, and 26 is our next cycle. So we just concluded 1 3-year and are now starting another. And, we really went through, I think, a pretty robust process for gauging the needs of our communities. We had a number of focus groups all across the 6 counties. I think we had about 138 various responses from surveying that we did to really gauge what the community felt were the most pressing needs. And we reflected that within our strategic plan. The top of the list really being access to services. And that's something that we're always working toward and striving to help individuals when they're ready to engage with services, that we're ready to receive them and to talk with them about, their pressing needs. And we really use what we call a person-centered approach, strengths-based, looking at what individuals' hopes and dreams and goals are, and then bringing supports around that person. We were pleased that although we would say certainly not enough, but still appreciated, state legislature provided funding for an 85-cent per hour direct care worker increase. And as I mentioned, a number of the services that we perform are through those contracted providers. In fact, it's about 60% of our budget is in those areas, like the community living support, staffing, or people in licensed settings and so forth. But the direct care worker wage is woefully low. We really need people to be able to experience a living wage, that they can continue in this profession, so that individuals who are receiving services can really count on continuity of care. Today, that's just really a challenge. The wages are not sufficient. People are looking at other types of employment that will pay them a higher wage, and really for oftentimes less demanding work. So we continue to advocate. Like I said, we're pleased that that was provided, and our contracts are reflective of this 85-cent per hour pass through. But we're certainly hoping for additional amounts. Those are some kind of agency-wide items that I wanted to discuss with you all. Again, I really, thank you for your support. I'm going to turn it over to Jen, and she'll talk about some more local efforts.
Great. So just to follow up a little bit about what Brian had shared about some of our statistics and services that we provide. At the current time, we are providing services to 1,255 individuals who are residing in Isabella County. That does not include the individuals that we're providing services to through our youth intervention specialists in the school systems or through our jail diversions services at the Isabella County Jail. And I'll talk a little bit more about some of those services and details throughout my presentation. During my presentation that I spoke on last year, I shared that our agency has moved to a team-based care model of providing treatment, and we continue to provide that level of care with individuals receiving our services, as all of those individuals are being assigned to a team. We have one team specifically dedicated to intensive children and family services. We have one team with a primary focus on providing services to adults and children with intellectual and developmental disabilities. And then we have 3 teams that are providing services to adults and children with primary mental illness diagnosis. Each team has frequent recurring team meetings, and each has a designated psychiatric provider and psychiatric nurse assigned to their team who participates in those weekly meetings. We've seen a great deal of success in our continued implementation of this program, with not only staff feeling supported and connected to their peers, but also with our consumers who are having support from multiple staff and are familiar with those different staff across the teams. We've also continued to offer monthly team meetings to the adult foster care homes within our county to provide a team support model to those providers. Providers have reported that they appreciate this model of support, which allows improved communication, improved response time, and having more connectedness to our agency. Just a couple of the programs that we offer within Isabella County that are unique to our county. One is Summit Clubhouse. So our Summit Clubhouse model is designed for adults with mental illness, and they recently completed their very in-depth accreditation process and were granted a 3-year conditional accreditation through the Clubhouse International model. Additionally, our program here in Isabella County was a training site for new colleagues through the Clubhouse Michigan Coalition. So multiple times during the last year, they've trained and allowed individuals from other clubhouses across the state to come and train and view the model that we're presenting within our community. And they continue to develop new transitional employment sites through local businesses. And transitional employment sites allow individuals who are kind of apprehensive about going back into the workforce to have an opportunity to try out some different avenues of employment in a shorter time period. So they're there for about 6 months and then get to decide if they want to continue trying that type of work or move into something different. So we've had transitional work sites across our county. Rick's has been a transitional, grocery store has been one, Little Caesars has been a site for us. And most recently, we've onboarded Listening Ear as an employment site for us. And then another program that we offer within Isabella County is called our Multisystemic Therapy Team, or MST team. And this is a very intensive team, excuse me, that is treating individuals, youth in the teenage era who are at risk of being placed in residential placement or coming out of residential placement or have been a perpetrator of problemized sexualized behavior. And so our supervisor for that just really wanted to highlight that they've been achieving their target goals that have been set by the national MST program overseeing them. So it's not something that they're just looking at it within their whole team, but it's compared to state and national data. And they have a national consultant that they can consult with to make sure that they're adhering to those program requirements in that evidence-based practice. So we're very excited about the success that we're seeing from that program as well. As Brian had also mentioned, we do a lot of community-based involvement. And so just to share a little bit of what our staff are doing out in the community, during fiscal year 23, so this last fiscal year that we just finished up, we provided 81 pre-booking services to a total of 67 individuals. And pre-booking services are services to individuals prior to them entering into the jail or legal system. During this period, we also provided 1,638 post-booking services to a total of 435 individuals. That's a huge increase from our last fiscal year that we were able to see. So we're seeing that the services that we're providing within the jail and law enforcement are being successful, or at least we're making a difference with contact there. Compared to, like I said, compared to fiscal year 22, we did see a slight decrease with our pre-booking services, but that quite a bit of an increase in our post-booking services. And we continue to employ a 40-hour per week staff within the Isabella County Jail who provides intervention. Incarcerated in that setting. We were able to successfully complete our mental health training in April of this year with our law enforcement. So we did offer this training to all 6 law enforcement agencies working within Isabella County. We offered a single day training across 3 different dates so that we could allow for more attendance opportunities at that training while trying not to create a significant shortage. This year, we did also encourage some dispatchers and jail staff to attend. And over the course of the 3 days that we offered the training, we trained over 80 of our local law enforcement officers and staff and received some positive feedback from that training as well. Last year, I talked a little bit again, kind of referencing what we did last year, but having it come to fruition in this last fiscal year, we talked about working to implement a tablet program with the Isabella County Sheriff's Office called the Virtual Crisis Clinic, and that program did go live this spring. And so we have been able to, the number is slightly low, 3 to 4, but really in our eyes, it's not a low number. It's a pretty exciting number to have 3 or 4. So this means that deputies on the road have a tablet that they can directly connect with our crisis workers, which prevents some individuals from having to go to the emergency room or being brought in to the hospital, that we can intervene and have a conversation with them. Again, it's a brief conversation, and then we can connect with them for further services, whether that's doing well checks or determining whether they need further intervention. So we've been very pleased with that program. And then we continue to partner with the Mount Pleasant Police Department on their peer program that they've implemented for when an officer needs to make a connection with a therapist within the community for a short-term intervention based upon an experience that they may have encountered. So we've had a few calls for that over the last fiscal year as well, which again, we're pleased to be able to offer that program to them and support them with that. We also have the youth intervention program or youth intervention services. So we have 2 staff in Isabella County who work with our local community schools to provide support and education to them. So these 2 ladies are amazing and are getting lots of kudos across the school districts. I'm constantly being looped into fantastic things that they're doing. And they put together a nice little flyer for me, but they had approximately 110 students over the last school year that were referred or served within the services that they offer. And they do about an average of 1 to 3 follow-ups for each of those students, and then an average of 2 to 3 parent coordination calls. So not only are they meeting with the student, but they're trying to connect with the parents and trying to get them referred to some level of services or connected to another service. It may not be our service, different service within the community. And they do that right in the school district. We're not right in the school building. We're not asking them to come to our office or anything like that. So we're not removing them from their environment whenever possible. They also provided 234 mental health lessons over the last school year to Isabella County students. Those programs included a Too Good for Drugs program that they partnered with 1016 for Mount Pleasant 5th and 6th graders, mean versus bullying lesson to the elementary schools, an anxiety lesson in the elementary schools, conflict resolution lesson in the elementary schools, a separation group at Ganyard Elementary, a trail out of the University of Michigan at the Odyssey School, middle school social media prevention at Beale City Schools, and then other mental health lessons per teacher request based upon the needs of the classroom. So they're really looking forward to continuing those programs over this next school year, as well as determining additional programming and supports that they can provide within the schools. We've done a number of community presentations and trainings throughout this last fiscal year. We had 3 staff who completed training to approximately 65 IRIDE staff on the topics of de-escalation, what is mental health, topics around gender identity, as well as working with those who are diagnosed with autism. So this was over the course of the summer, and we saw really positive results from being able to offer that education to those staff and drivers. We did a short training to about 7 staff at the Isabel Soup Kitchen on how to work with those who have a mental illness. 2 lunch and learns were completed for the Child Advocacy Center on what is mental illness and suicide prevention. Training was provided to the Senior Companion Program at the Commission on Aging. Training was completed to Parks and Recreation staff before their summer work began this past summer. We provided some suicide education to the community church and some of their staff, as well as in services to the Child Advocacy Center on areas of de-escalation and secondary trauma. And so we continue to offer those to the community with some upcoming presentations to the Rotary Group, as well as to our local library. Additionally, we continue to participate in a number of local boards, coalitions, and meetings. I try to encompass them all, but I'm sure I'm missing a few with this description here. But we are part of the Isabella County Community Collaborative, the Isabella Substance Awareness Coalition, the Isabella County Community Child Advocacy Center, our School Safety Alliance, a local multidisciplinary team, adult and juvenile drug court meetings, a quality improvement initiative with the local MDHHS office, the Tiny Homes Village development group that's working. We have partner meetings between our school groups and local providers with those with developmental disabilities and supporting them. And then another group that we're just recently became involved with is a local group called the Care Group, which is working with the aging population and helping to provide services to that group. And I just wanted to finish my presentation with a success story. And I thought over the last couple of weeks, what would be a great success story to share? And so I did ask permission from this person. I'm not going to share her name, but just to be able to share a little bit about her. And so we had an individual about 5 or 6 years ago, who was just a frequent utilizer of our crisis services and was really having a difficult time in her life, at a difficult point in her life, having young children, having a lot of self-defeating and self-harming behaviors. And we were really working hard to try to provide services and help her. After many attempts to engage her and get her connected to services, we were finally able to see the crisis contacts decrease over a period of time. Eventually, we were able to work with her, and we were able to work together to get her to participate in our year-long dialectical behavior therapy program, which is an intensive program that provides individual therapy, weekly skills group. It offers peer support as well as 24/7 phone coaching. And after successfully completing her year-long DBT treatment, she really decided that she wanted to help others the way that she herself had been helped and supported. And so she applied for one of our peer support positions and was hired by our agency over a year ago. She also, throughout this process, had her bachelor's and a master's degree that she had never fully utilized. And so after she started working as a peer support and really found that the work that she was doing was enjoyable and helped her own mental health treatment, she was finding that being a model of self-care was amazing, and just getting a lot of good feedback from not only the individuals that she was working with, but the peers in her office that were working with her. And she really excelled within her job as a peer. So more recently, she decided to challenge herself further and apply for a case management position, which she officially started this past Monday. And she has been there every day with bells and whistles and just really jumped enthusiastically into this new role and is so excited for what is yet to come within her recovery and job success to help the individuals that she continues to work with.
Great.
Nice.
You know, I think that these are the kinds of things that, that you can see, we're getting the word out, people are being helped and lives are being impacted for the good. And that this kind of story that Jen shares, what a motivated employee to help. There's nothing better that when you're helped yourself and then wanting to give back and have those experiences that you can bring to bear when you're working with somebody. It's just awesome. So
Change not only her life, but the lives of her children. It's huge. Yeah.
any questions that anybody has? That's kind of what we had prepared to come and share, but entertain any questions that.
Any questions?
Just have a comment.
Yep, Chip.
I'm so impressed by the creative and extensive connections you've made with so many organizations and so many communities. I'm really impressed with that. It's very heartening.
I'll just say on that point, this is why the public mental health system that we have really is effective. It's these kinds of community partnerships. We're always under constant threats around, the privatization of the mental health services, the vulnerable citizens in our communities. And these kinds of community-wide efforts that are creative, as you mentioned, out of the box thinking, all the trainings that, Jen was going through with the various communities within or organizations, whether it's Parks and Rec or, the number of different groups that we've been able to provide training, get the word out, is pretty unique and part of why we're able to do what we're doing. So.
Hutchinson.
Yeah, this is more of a comment. Commissioner Marino and myself are on the 6-county board, and it's just, I've been blown away with how much information that I've received, that how many people are touched with these programs. It's just kudos to all the work you do.
Sure, Jelzinski.
I just want to thank the participation of community mental health on this county committee as we're looking to use our opioid settlement funds
I know we could use them real quick, but we expect we kind of project we're going to have about $3.5 million over the next 18, 20 years. And we've chosen a course to put it into the community foundation and let that principal grow and use the interest to make annual grants to various organizations, professional entities that can use it to address opioid addiction. And I think a small percentage of that can also be used for other types of addiction, but we haven't come to the final decision yet, but we're moving in that direction. And thank you for your help.
Yeah, we appreciate that. We're this close. And that.
Did have on that, just a brief comment. I was at called the Directors Forum, but it's basically the executive director of CMH's gather quarterly in Lansing. And the person that is working on the state's efforts from Michigan Department of Health and Human Services around the opioid settlements was asked about whether it had to be only opioids. And he said, no, it doesn't. It's not restricted to that in terms of other forms of substances that are being misused. So there is some latitude as well in terms of some of those funds.
Yeah, I think 15% can be used for non-opioid, but knowing some of these things as they progress, it's probably going to open up even more. So to use it for a number of different addictions.
Mr. Engler.
Yeah, maybe my fellow commissioners already know this. I'll show my ignorance on this, but looking through your numbers there, and you had an increase of like 6,500 requests for services. And like I'm looking at it, and like 40% of them did not follow through. What is that? Is there a main reason for that? That seems like, why do people not follow through?
It is a mixture of things. Sometimes people are connecting with us and they are better served by another community member organization. So we're able to do what we call a warm handoff or a warm referral to another organization that is better served, or that the person may not meet eligibility requirements. And that is part of this access to service that we continue to have to work on. I think I mentioned that about 93% of our funding is Medicaid. Now we do have what's called general fund, and that does go to serve individuals who have no insurance. And so, we do have that, but we do have because we're charged to serve what we call the priority population. And these are meeting the populations that I described: serious emotional disturbance for kids, or serious and persistent mental illness, or developmental disability. Those all have some criteria associated with those designations. And so in some cases, they make that call, they don't meet that criteria for access to services. That's one part of that. Unfortunately, a lot of times people make a contact, but then there's no follow-up. I mean, we try to do some follow-up, but they don't then continue on and engage. We have a process that we're working towards called same-day access. And we really are attempting to, when a person calls us, that we can get them into service or for that assessment right away, because we know that it's very much of a challenge for a person to get the courage up and say, I'm ready to get help. Because maybe they feel that way today because they've got something that's triggering or something going on, but the next day or the next week, and they feel like, I'm not feeling the pain as much today, and I'm not going to make that call, or I'm not going to continue on. And so we try to engage people, when they're at that point of readiness on that. Those are some of the, responses that I have. Thanks.
I know a big part of what the agency does is community living supports. Maybe you could explain that briefly, what that entails.
So community living supports, we have acronyms for everything. So we call it CLS. And so that is a program that we have where we contract with providers in our community. So places like Listening Ear, McBride, some other providers. And so they provide support to teach individuals who are living in the community the skills to continue to live independently. So it's really helping them to live in their environment. So maybe one of their goals may be that they want to live independently, but they struggle with cooking healthy meals. So they'll come in and they have a goal set, and the CLS provider or worker will come in and work to teach them how to go to the grocery store and pick out healthy things, how to find healthy recipes, and how to cook those types of things. So there's a number of skills that individuals could use CLS for. That's just one example. It could be engaging socially or getting into community inclusion. So having difficulties to be able to get into the community and find things to do. So they may have an individual who's helping them and teaching them how to engage in those supports and services. So it's really a teaching service to be able to strive towards as much independence as they can possibly have within their environment and community.
Sometimes a person may have their safety related issues in terms of being out in the community as well, maybe not having the full awareness of how to, navigate just basics of being.
Mhm. Well, I appreciate you being here tonight. One of the most rewarding things about this job has been serving on the board for CMAH. It's just been a real eye opener. Amazing amount of stuff. And I appreciate the relationship that you have with the schools for the youth intervention programs, and with law enforcement for the jail diversion programs and other things. It's really a mutually beneficial relationship. Cooperative relationship that you have with those entities. Appreciate that. Any other questions? Okay. Thanks again. Appreciate it.
Thank you.
Okay, moving on. We have no appointments to boards and commissions, committee reports, Finance and Administration Committee.
Thank you, Mr. Chairman. Our first item is consider ratifying and placing on file the September 15th, 2023 invoice list in the amount of $133,452.88. The September 2nd, 2023 invoice list in the amount of $172,936.31 in the adjustment list dated September 28th, 2023. So I kind of explained to the public that these bills get many eyes looked at them before they come to us for our regular meeting and approval for payment. But they go to the departments, the department head looks at it, it goes to administration looks at it. Finally, it comes to everyone in their emails, and it comes then to our committee for review, and then to the work session for some direct questions if there are any, and then finally to the regular meeting. We typically look at these. A lot of the bills are ones that we see over and over again. They're contract payments, different agreements with Michigan State University for cooperative extension, so on and so forth. Every once in a while, there's something different, and we ask questions about it. But in terms of the September 15th list, I really didn't see anything in the identification of those bills that exceed $5,000 or in the body of the bills of the lesser amounts. That I don't know if anybody else had any questions on any of those. Then we'll move on to the September 22nd list. Same comments, again, very customary payments. The only one that caught my attention as I was reviewing the background bills was a payment to K&S Liquor Store. And I'm thinking, what's that going on? But that's from the clerk's office. It's a payment for court-approved restitution to that entity. So nobody in the county is using liquor that I've. Any other questions? The concerns on that particular list? To the adjustment list. The adjustment list identifies any changes or additions to the two invoice lists that have been made since we had those before us in our various ways. And most of these come up because we can make early payment for a discount, such as Gordon Foods, or we make early payment to avoid a late fee, since the different payment schedules for the vendor and for the county are different. So we move those forward to make sure we don't have any late payment fees. On these, I didn't see anything that I was concerned about. Any questions or comments on the adjustment list? Seeing none, hearing none, I guess we'll move this then forward to tonight's regular meeting.
Our second item for the Finance and Administration Committee is to consider approving the prime contract change order number 10 with Clark Construction and the net additional amount of $81,896 and authorize the board chair to sign the same. This prime contract change order number 10 is pretty straightforward, just a couple of bigger items on it, but I'm going to turn this over to Heidi, who's our project manager out there at the new sheriff's office and correctional facility. Good afternoon. Heidi.
Good afternoon, everybody.
Hi.
Yes, we have prime contract number 10. This one here, we had a few items on here. The biggest one there was the Remus Road undercut. While we were preparing the Remus Road extension and to pave it, we found some bad soils out there, and it was about 228 feet long by 32 inches or 32 feet wide and 2 feet deep. So we had to remove those soils and put new sand and gravel back in there to make sure that the road was stabilized. We did find that we had up at the mechanical yard that we had an existing sidewalk there that we no longer needed. So we did have a savings of that of $1,248. Then we also had borrowed light frame on the backside of the jail. So that would face the that'd be the south side. The information was not included on the drawings, so we had an add there of $1,587. And then we had an allowance in our foundation contractor of $10,000 in case anything arose that we needed to address or take care of. And we did not use any of that $10,000 allowance, so that is a credit back to the project. So the total of this is, what was it? Why can't I find it?
Yeah, Heidi, I've got $81,896 for the grand total.
Thank you. Yes.
I think that pretty much sums it up for the big ticket items on that change order, correct?
Correct. Yes.
Okay. Well, the thing to point out is, again, this will not be taken from our contingency line in the project budget. Rather, it's going to come from our buyout line that we've accumulated with Clark Construction over the for previous deductions in the cost of this project. So again, we have not gotten into our contingency line yet. So we're still working on that buyout line. So thank you, Heidi.
You're welcome.
Appreciate it.
I know in the past we get a good information from Heidi when we have a change order, but I know we asked in the past for a little more transparency or a little more input on changes that are being made. And I do want to compliment you on the fact that we now have a potential change order log where you anticipate down the line what additional costs might be. And I do appreciate that. I know
You're
that
welcome.
we're going to eventually probably have to pump a few more dollars in as the project moves forward, which is not uncommon as things get discovered and have to make corrections. But I do thank you.
Oh, you're welcome.
Likewise, I know for my fellow commissioners, we ask for this information on your behalf so that you can see what's coming down the road before it comes to us. I thought that was the benefit to you as much as it is us who are on the finance committee. So hopefully you'll take advantage of that.
No one likes surprises.
Especially. Any other comments or questions, commissioners? Hearing none, we'll move this item to our regular board session tonight. Thanks, Heidi.
Thank you. Have a good night.
You, Heidi. Our third and final item is consider adopting the recommended language revisions to policy 101 Isabella County Personnel Manual for non-represented part-time employees, section F, holidays, section H, paid time off, and take effect immediately upon adoption. So we know that we've been faced with employee turnover, challenges to fill open positions. And so administration's been working with department heads, elected officials in a very cooperative manner to come up with some good ways to maybe make employment with the county a little bit more attractive. And at this time, Madam Administrator, would you like to address the changes to the part-time employee?
Thank you, Vice Chairman Jalozinski. The changes that are on the table tonight are essentially language changes to allow part-time employees to take all of our recognized holidays. As it stands right now in policy, part-time employees only receive Christmas Day and New Year's Day. As we've heard from departments, it causes a hardship in some departments because then part-time, if they want reimbursed at all for holiday hours, they're having to take PTO when the person working next to them is getting paid for the holidays. So through discussions, this is something that department heads, electeds are supportive of. I do know, and we did have some conversation at finance, this probably budgetary wise affects the MRF the most negatively, if you will, because a lot of them work the holidays. Right? And Director Borton has utilized part-time employees in the past while full-time are off on a holiday to work without any extra budgetary burden. So you could compare that to Commission on Aging, where generally they don't work their holidays. So budgetarily, we're paying a part-timer to work. And we budget for 29 hours a week, whether they're working or whether it's holiday pay. It really doesn't affect the budget, if you will, of Commission on Aging. But those where we're working holidays, policy is, and it's not changing. If you work a holiday, you're getting time and a half for it, in addition to regular straight pay for the holiday. Now, for part-timers, regular straight pay for the holiday would be prorated based on the hours they were scheduled to work that day. It might be 7.5 hours that they're scheduled to work that day. The other caveat in here in the language change, they'd have to be scheduled to work that day if they're part-time. They're not going to just receive the holidays for being a part-time employee. They would have to be scheduled on, say, Monday, Memorial Day, to receive that holiday. Further, there's some talk about people who work in Parks and Rec. That's a 7-day operation. Just MRF is more like a 6-day operation. But those working the actual holiday in a 7-day type operation, they get the holiday pay for working that holiday regardless of when we observe it. And it's actually already addressed in policy. We didn't change that. So if we can walk through the policy changes, if you'd like, there's only 3 pages in here that are changing. One is on page 12. It's the holidays section. And we're just adding, and right now it says all regular full-time employees who meet the eligibility requirements will receive 1 day's holiday pay, right? We just added and part-time in there. Pretty simple. On the next page 13 on a holiday worked, like I just said, we are adding that part-time employees eligible for holiday who are required to work on any of the holidays shall be paid that straight time for the number of holidays, for the number of hours normally scheduled to work. And then they're given the option that time and a half pay can either be given as overtime or comp time. Our policy used to say that it had to be comp. We know that employees are given an option. So we kind of cleaned that up in here as well. The only other place in policy that we saw needed revision was back on page 24. This is where, when I said part-time employees now only receive Christmas Day and New Year's Day, that is where it states that. So we're just reiterating that it's straight time at their regular pay, but for all holidays recognized in F1 section for which they're scheduled to work. Pretty straightforward changes. I think this is a fantastic move for new hires. This is kind of going more into, I think, what is expected. I've been through some orientations lately where new hires were pretty surprised. They only, you know, they didn't get the holidays for 60 days like we had before, and part-timers, maybe a little surprised they weren't getting holiday pay. So I think this is more in line with what other employers are doing. And I think it's in line with what's expected, and it's not a lot, but it's something. It's going in the right direction. And just like this board, you know, took on the increase for healthcare this year and decided to fund that and not pass it on. I just think it shows that this board is doing what it can, where it can, to make it a better place to work here. Yes, sir.
Yeah, you brought up the MRF a little bit earlier, and they get a lot of their part-time through Manpower. Now, is that separate? Or can you go in a little bit on what the county required to cover when they do contractual labor on them?
So what Commissioner Engler is asking about is in addition to county employees at the MRF, we also employ a handful of Manpower labor. So it's contracted labor, and they have their own rules at Manpower. So they don't receive holiday pay from us. If they worked the holiday, it would just be their straight pay from Manpower, or through Manpower. Of course, Manpower bills us for it. But they, to my knowledge, wouldn't receive anything additional. Now, I do believe that Director Borton is probably going to be bringing forward a consideration at some point to increase the wage, probably for the Manpower labor. That's set contractually, you know, with the contract that the county has with Manpower, but it hasn't been addressed in a couple of years. So that's a great point and a wonderful distinction that says no impact on that contracted labor force. Great question.
I know I worked for 3 different counties, and all the counties seem more and more dependent on part-time work for various job functions that don't come up to a need for a full-time person. And it seems like it's good that we're not treating an employee as a second-class employee just because they're part-time and don't rise to the level of full-time. So I think it's a good move. And I don't think this is costing our general fund that much.
Correct. The general fund wasn't it around $1,200 maybe a year? And that is, we've got very few. We have a part-time custodian and facilities. We have a part-time jail cook. Custodian does not work holidays. The jail cook does, you know, and so but the general fund impact, I want to say, was around $1,200, $1,400. It is minimal. Right.
Any other questions dealing with this topic? With that, we'll move this on to tonight's meeting, and Finance Administration Committee work agenda is now completed.
Thank you, commissioners. That brings us to Criminal Justice and County Affairs Committee.
Give the first one.
Okay. Consider approving software license agreement between Defenders Data and Isabel County Public Defender's Office, providing case management software, and authorize the board chairperson to sign the same. And I believe we have Public Defender Hausman on here. I'll let you explain this. It was kind of interesting what we had in committee, but I'll let you inform everybody.
I was counting on you just like 2 weeks ago to kind of take the ball on this one, but this is our case management software that we've been using since our inception back in fall of 2019. What had actually occurred was we never had a contract with them. They had provided us a trial version of their software, and there was never any follow-up done on their end to see if we wanted to continue using the program, or our end to figure out, hey, we need to pay for this. And we contacted them with some IT issues, and they asked us, well, are you a vendor with us? Because we have no record of Isabella County existing in our system. And so we had talked to them. They sent me over a contract. Due to that lapse, they actually offered us the 2019 contract rates. So that's a benefit to us. So for the whole program for 15 users with some additional features that didn't exist back in 2019, it's $4,500 a year, which is well within our budget on supplies and services, which is what this would fall under, which with MIDC is our second largest line item. Our first being obviously personnel and fringe benefits. The contract has been vetted by the folks at Cole Stoker. They got back to me. We sent the contract over to Justice Works Defender Data, and they approved those changes. So the contract in front of you is the final contract, and all the changes have been approved.
Yeah, I kind of actually like the last contract, and in fact, we could have doubled it because 000, but I'm pretty sure we don't get that deal anymore. So, yeah, is there any more questions for Public Defender Hausman on this? Pretty straightforward. Okay, seeing none, we'll move this forward to the regular meeting.
Thank you.
All right, item number 2, consider approving inmate healthcare services for WellPath for fiscal year 2024 in the amount of $579,130. Has to do with the RFP for health services for correctional facilities. Sheriff Maine will guide us through his RFP assessment.
So every 3 years or so, we do an RFP for inmate medical. It's an extremely expensive contract that we have, but a pretty critical contract as well. We were up October 1 for this contract. We had been put on notice about 2 or 3 months prior by our current vendor that the price was going up substantial. Good timing, because we're gonna do an RFP. We were gonna work the magic and bring that price down, but apparently that is industry standard. They still come out on top. The other, or one of the other out of the 3 was way high. The other one only provided personnel, didn't do anything on top of that other than just the personnel. So long story short, WellPath again come up on top of that. They have been a phenomenal addition to our family. They do a great job in the jail. They know the ins and out of it. They've seen over 7,000 inmates last year alone. The nurse and doctor did. So they do a lot of work in there for us. So the current RFP is at $579,130. It is a substantial change from the $427,000 that we landed on in 2023. We did budget the amount to cover that, so that is a good thing. We kind of anticipated this going high. Again, I have no issues with WellPath. It was just financially, we needed to make sure we were looking at everything that we could, and we did. So I would recommend or ask at least the board to consider approving this RFP. We do not have a contract yet. If the RFP is approved tonight, then we'll start that contract process. And once that contract process is vetted between the attorneys, we'll bring that back to the board for final approval. I did speak with WellPath. They said they have no problem staying on board and continuing it the way it is for a few weeks here to get us to that. So they were real good with that. So that worked out well for us as well. Questions?
First, I want to thank you for, due diligence of going over the RFP. I'm looking at the proposals from the 3 companies, drastically different presentations and what they cover, and you must have spent a lot of your precious time.
That seems to be consistent. The last couple I've done since I've been here, they're not comparing apples and apples. It really is. You got to pick pieces out. We try to build Excel charts and graphs and try to figure it all out, but it's very difficult to really kind of drill down on them. They are drastically different. So,
Yeah, I just want to make a comment, and I think there was only really 2 choices in here. The ACH was, I never seen this before, as far as it was 200,000 over. And then it had in the bottom of the contract, it had a 7% increase or whichever is higher. And so I'm thinking they kind of threw that out there, hoping that they didn't really want it, but they got it. It'd be great, because I've never seen one kind of quoted like that. It was strange.
It's a pretty volatile market right now. Even WellPath was consistent. The CPI was at 3%. This time it's 4.5, up to 4.5. So I think it's just such a volatile market that they instead of trying to narrow it down, they just got to keep it pretty wide because they don't know what's going to happen. So, yeah.
Commissioner Jałozinski.
Has there been a movement in changing the ability for inmates to be able to draw upon Medicare funding for healthcare?
So there was a lot of stuff coming through MAC. I was reading that stuff as well that was coming through. I was excited, like probably every county commissioner in every county in the state. And then it went dormant. But I know there's a lot of stuff in Lansing going through right now. So I don't think it's off the table. I think it's just sitting there yet. If you can bend an ear of anybody that travels south to Lansing and spends time in that building, I would say we really need to work on that. I mean, that would substantially change that cost for us and help. I mean, it's every county. I mean, it's just a drastic number. So I haven't heard anything recently, but I hope it's not went to a pile that nobody will ever find again. So.
Thank you.
Any other questions from?
Just kind of a comment, interesting to hear from Jen McNally about their funding and where that comes from. And ultimately services reaching inmates. It's just odd to me why additional federal funding couldn't get funneled to the inmate,
So,
Good fight,
historically,
Good fight, Sheriff.
we've only had about 20 hours a week of mental health from WellPath, and it's pretty expensive. So we've always tried to keep that down. We've backfilled that with CMH. And when they came to me a couple years ago and said, hey, we have some GF dollars, we can put somebody in 40 hours a week. What do you think? And I'm like, any day, every way, so our guy comes in there and he is phenomenal. I'll be honest with you, we've worked him in the front lobby when we've had walk-ins. We was like, hey, why don't you come up here? We're gonna need your services for a few minutes, but he's been really good. We just don't have the real estate for him. He goes back to our break room and sets up shop with these computers and stuff and writes these reports and stuff. So there's just no place for him in the jail. I can't wait to get in the new facility and give them their own room and place that they can meet and have private conversations and maybe really do some real good there. But they do a phenomenal job, and they do a lot of recommendations and help us out a ton when we get those folks in there that are plagued with that kind of stuff.
Well, I think along those lines too, I think they help people on their way out as well.
It bridges that gap, Commissioner. It really does.
Yeah.
When they're in there, so it's WellPath does a good job, but when they leave, WellPath doesn't follow up with them. CMH certainly follows up with them, I think they undercredit themselves a little bit when they were up here. I mean, we had a pretty serious incident a few weeks ago, and tragic, self-inflicted issue, and I called one of her counterparts that was here and said, hey, I know you've dealt with this person a couple of times. Can you come to the scene right now? 10 minutes later, she was standing beside me because I was thinking, and she also does some stuff with our negotiation team on emergency services team. And so, it's just nice to have their phone numbers to call and say, hey, I need some help. When you turn around, they're standing behind you. So, and vice versa. They've called us and said, hey, we need to go do something, but we need somebody to go with us. And typically that's just to stand there and look impressive, I guess. I'm not sure, but they do all the magic and we just stand back and make sure it's safe. So,
Yeah. It's
Go team as well.
If there are no further questions, we'll move that forward to tonight.
Thank you, Sheriff.
And Chairperson, hope that ends the work of the criminal justice and county affairs.
Thank you, commissioners. And that brings us to as Commissioner Marino said, the fully staffed Human Resources and Public Works Committee.
Thank you, Mr. Chair. Our first item is consider approving zoning amendment number 23-03 to rezone the subject property from commercial industrial CI to general commercial C1 and authorize the board chair to sign the same. We have Tim Neoport here today.
Yeah,
Explain this to us.
This is, as stated, Amendment 2303. This is another rezoning in a similar area to the previous two we did a couple months back. There is a piece of property, a large piece of property that has been zoned CI, which is a commercial industrial mixed use development area, just east of Wademan, about a half mile. This property has been, there's been several requests here for rezonings based on the fact that in the CI district, the uses that are special conditions in the individual district, the commercial district and the industrial district alone are not allowed. Only the permitted uses in the commercial and industrial district are allowed in the CI district. And the applicant is looking to do something that is of special use. So he has requested to move the property into a CI district, the general commercial district, which would allow him to operate a special use activity through the planning commission. This property is currently has a storage building on it, and I believe it is looking to move into, they're looking to move in and put in some rental storage units, which is that special use activity. It is adjacent to a piece of property we did change some time ago to C1. The planning commission did hold a public hearing at their September 14th meeting, heard no comments during the public hearing, nor did we receive any comments prior to the meeting. Planning commission did make a recommendation to you for that approval, and your request for approval is being sought tonight.
Any questions or comments on this item, commissioners?
Yeah, this is just another good neighbor type activity.
Oh, go ahead.
I just want to say thank you, Tim, for working with Brian to get the map in the packet. It's a lot more meaningful to be looking at that. Thank you.
Sure, yeah, not a problem. Yep.
Any more questions or comments? Being none, we'll bring this to our next meeting. Thank you.
Thank you.
Your next
Thank you.
item, consider approving the agreement between Isabel County and North Analytic Services LLC for asbestos testing in the amount of $10,400 and authorize board chairperson to sign the same. Have facility director Shoemaker.
Hello. This is basically a pretty straightforward staff report, as you can see. In order to be able to do any kind of renovations on the administration building like we've been planning, the EPA requires that we have their building tested. The building owners and contractors are required to make sure the building is asbestos free before there's any construction being performed or renovation. So this basically will guarantee that our building is asbestos free so we can move forward.
Just a comment, but and I said this to the committee, but they almost have to test every pipe joint, because you don't know. They might look exactly the same. They might be right beside each other. One will have asbestos and one won't. And we run into that at the university all the time. We tear a bulletin board off. If it's stuck on there with glue pods, we have to test those before we start chipping them off there. And 90% of the time, they're good. The other 10%, they're hot. So you just never know.
I brought that up to the contractor. I'm like, every joint. I mean, you think when a contractor's coming in, he's packing all these joints that he's using something different every time. And he told me about a school system that had like 70 some samples done and they found not a hot one until all of a sudden it was the 33rd sample and it was the only one they found. Well, it's just kind of hard to believe that you'd find 1 out of 70 when they're building the building with the same material you would think, but this will take care of that for us and ensure that.
Yep. Appreciate your work on this.
I was just going to say, we purchased a piece of parkland in Clinton County. We had an old farmhouse we wanted to tear down. We had to have that inspected. They found asbestos in the bottom of the sink. You know, they put a insulating coating on it and a little bit in some spackling for drywall.
Yep.
With that, we had to put a positive airflow and hazmat suits on, and it got to be an expensive proposition to tear that building down, but
Well, I'm hopeful that I don't find anything because remediation is expensive.
Further questions? Thank you.
Very good. Thank you, Director.
Okay, our last item is consider approving the issuance of a commitment letter to Union Township regarding proper operations of the Commission on Aging Pavilion sewer system. We have Jennifer Crawford here. She said she's been learning a lot of stuff about about these processes, right?
We sure have. So just another hoop to jump through, but while JBS Contracting was trying once again to get the permits, Union Township has now requested from the county a letter that is signed, notarized and registered with the Register of Deeds, just stating that we will properly operate and maintain the sewer system that is in the proposed pavilion project. So hopefully, if this is approved and done, we will have a permit soon and maybe have some groundbreaking.
Any questions or comments at this point? It's pretty straightforward, I'd say. Okay, that's the case.
Just a quick, are you still hoping to get the building constructed this fall, or is it a spring project now?
Will not be completed this fall, for sure. I mean, even a couple months ago, when we thought we were going to be starting, they were hoping to break ground and get as much done as they could this fall with the structure, and then wait and come back in the spring to finish it. We could have paid extra to have them plastic everything and finish it all in the winter time, but there's no sense because we wouldn't be using it. So, so they're just the plan was to get done what they can get done and come back and finish in the spring.
Yeah, thank you.
And I did check with Facilities Director Shoemaker, and they do know how to properly operate and maintain the sewer system. So,
Yeah,
so the letter is true.
a certain way you have to flush the handle.
I don't even know.
If there are no more questions or comments, we'll put this on
Serious questions.
the regular sessions agenda.
Yeah.
Thank you.
Thank you, Director.
That concludes the work of the Human Resources and Public Works. Here.
Thank you, commissioners. And we have no intergovernmental affairs this evening, no administrator controller issues, no unfinished business. Under new business, we have the engagement letter. Consider approving the engagement letter between Isabella County and Fisher Broyles for legal services. And I believe Administrator Controller Frost is going to walk us through that item.
Absolutely, Chairman. Thank you. My apologies, commissioners, for the late addition. We've been working since the letter's dated August 29th. I think we received it early September. Notice of potential copyright infringement, and the illustrator or author of the images that we utilized is suggesting he is likely to file suit against the county. So what we were noticed was, and I'm just going to share my screen just to show you, for of course educational purposes, what the image was we used. And this, my understanding is it stems back from 2006, 2007, when the Parks and Recreation Department was regularly being asked, what kind of fish might we find in this park? And so dutifully, the director, don't show them? Is that what you're saying? Oh, okay. That's a good point. That's a really good point. I was kind of thinking I would, just show you, I'll show them I have a copy of the notice with me. So if anyone is interested in seeing the images, come and look at my screen. Thanks, Michelle. I think it's a good point, because the day that we were noticed, our new Parks and Rec director, Alexis Hansen, promptly, as soon as she received and read the letter, notified park employees to take all these posters down. So basically what had happened nearly 20 years ago now, an intern went out on the World Wide Web, found some really great illustrations of some fish pictures on the web, put together a poster. At this park, you'll find these fish species. At this park, you'll find these. And we used those posters for strictly educational purposes, right? We didn't say buy a park pass and you get to see our fish poster, right? We didn't say we're selling fish, here's our fish poster and won't you buy a fish license, or selling fishing equipment or bait or anything like that. No monetary gain from these, strictly educational, right? But the illustrator has copyrighted images that we took. So Michelle, thank you and your staff. You're very diligent to get those images off our servers. Thank you for alerting me. Don't share because this is being recorded to YouTube. So we removed the physical images. We've removed it from our server. If you visit the website, I think there's a caching issue that might happen where I suppose you could still see those, but they're being rotated out. I'm not sure what the technological term for that is. So fast forward, we have coverage for this, right? Right now it's a notice, but that notice required response, and it's not a response like we understand, but an attorney's adequate response to this copyright infringement notice. So we have coverage through MMRMA or with property and liability coverage. And so anytime we're sued, sheriff, this happens to him quite often. Not the copyright infringement, but the suing of the sheriff.
You hear that?
MMRMA's job security. So we have a self-insured retention fund with MMRMA, and we fund the first $75,000 of these claims. So when something like this happens, they'll engage with a firm that works with them. They'll assign this to copyright infringement folks. Apparently that's Fisher Broyles in this instance. But MMRMA is still the ones that get the bills from Fisher Broyles for this, and MMRMA pays that, but it will come out of our self-insured retention fund to a point, right? Okay, so we all understand how that works. I've been working with Fisher Broyles since they were assigned about 2 weeks ago. And they are wanting this engagement letter with us. Again, we are not responsible directly for the payments. Fisher Broyles will invoice MMRMA. They'll take it out of our self-insured retention fund. Think of anything. This is why staff reports are nice and time is nice, because we usually just have time to think about all this and put it in a staff report. But really, since we've been working with them, they wanted the engagement letter. They didn't want to wait an additional 3 weeks, I think, until 2 weeks until our next meeting. So we added it tonight. Thanks for agreeing to put it on. Are there any questions about what it's about or what might be coming? They're going to respond on our behalf. They're going to reach out. As I understand it, educational purposes is one of the defenses of copyright infringement. Because we didn't have any monetary gain, our chances are good in this regard. I think our attorney was going to reach out to them to say it's educational purposes only. But we'll see where it might go from here. But we need that attorney to make that communication, not us. I will say this engagement letter, we did send to our legal counsel. And he has no legal objection to the form of the agreement, isn't recommending any changes.
Sounds like a sensible course of action.
Like the representation.
Any questions, comments on that? Okay, we will consider that motion at tonight's session. And we will move right along to general public comments. Is there anyone for general public comments?
Think from Dr. Bills.
Oh.
We're just so used
To hearing, no.
That's okay.
It's the only reason I come to these meetings. It's for you. These guys are boring.
I started having my website, I don't know, 20 years ago. I pulled something off the internet, probably what you guys did, and a letter from Getty Image.
Oh, yeah.
They were like demanding all this money, and I'm like, so I Googled it, and just sent them a cease and desist letter, and they did, and I did, and I never heard from them again. So
Thank you.
Yeah.
Thank you.
I just
Gotcha,
sent them a
and
cease and
attorney
desist,
bill.
and I said, and I didn't even get a lawyer for it. I just sent it.
Okay. Well, thank you.
Anyway, because they harass people, that particular. It's probably liable now, but anyway. Um, So, thank you for your support.
Thank you. Dr.
Thank you.
Bills.
Good luck with that, Mindy.
Okay, and that brings us to announcements. Commissioners, any announcements? Yeah, Commissioner Marino.
I'd like to let the commissioners know that I did attend the 125th anniversary conference of Michigan Association of Counties, and it was informative. They were informative and timely presentations, which I learned a lot at, and also festive celebrations. In fact, after I came back from dinner at a very fancy dinner club in Kalamazoo, I looked into the activities, and there was a conga line. So dueling pianos and a band. So it was a good time, was had by all, and there was lots of county measures and issues discussed in the legislative update. And so I will share with commissioners some of the issues that we talked about, and also places to advocate for our, well, today we passed our platform, and so I'll keep you all up to date on that. And I also encourage other commissioners to participate in these conferences. It's I've been a commissioner for 14 years, so I have a lot of friends that I see at these occasions. The latest issues that we have, and they're so similar, and there's, we take tips from each other and suggestions to each other, and
Let me just add one thing. He's like a rock star.
it's like a what?
He's like a rock star when you go to one of these. He knows everybody. And he's
He
very
does know.
popular. So I agree. Very, very informative and very educational. So
I just want to know if there's a video of the Congo line.
There might, I of all the presentations that we had, they're all going to be shareable, and you can all see them and see the points and see the presenters and all that. So and today it was like NACO, and they have some really good tool kits on AI and that sort of thing, and they have working groups, and actually a fellow commissioner from Wayne County, she asked me to be in the environmental committee on NACO, and I said yes. I mean, she hardly could talk to me, and then I went, why is she talking to me? Oh, now I know. So that could happen too, but
The breakout sessions are always good, always informative, and the networking with other commissioners around the state is so helpful to get to know other folks. Yeah. We appreciate.
oh, I went to the presentation on the new plans for the material plans that are coming out by the DEQ, and Gladwin there, Mecosta County was there, and Gladwin County, they said, oh yeah, when's the next feasibility meeting? We want to come and we want to know about it. We want to do it. We want to collaborate with you. So
awesome.
it was very great. It was exciting.
Other one.
Good example of the benefit of that networking. Yep, Commissioner Hutchinson.
Yes, I want to do a big shout out to my fellow commissioner, Mr. Marino, in all his coverage of when I was absent, and he did amazing, and I thank him very much.
Got a lot.
Back.
Welcome
Yes,
back. sir.
glad to
Good
have you back.
Mhm.
Any other announcements? I have, so yesterday I attended 3 different events. And you'll see what the common denominator on those 3 was, but the first one was an opiate settlement roundtable. Put on by the CMU College of Medicine. There was quite a few tribal members there. Chief Jackson was there, and some other folks. The chief of police from the tribe was there, some other law enforcement from CMU, and Attorney General Dana Nessel. Wow, kind of hosted this thing, and we had a discussion about how the funds were to be used. She gave me a contact person in her office that if we have questions about whether we're legitimately using those funds, we can contact this person and find out for sure, because it's her office that directs those funds. So it's a good discussion. I was able to kind of get the word out that we will most likely be putting our funds in an endowment fund and then looking for proposals for programming to fund. So that was good to kind of put that bug in everybody's ear. Myself and Prosecutor Barbary were there for Isabella County. So great event. The other event I went to was a tour of the animal shelter. Also with Prosecutor Barbary, he is on the HATS board, and Dana Nessel was also there. But took a tour, Director Tillotson of the shelter gave us a tour, and they really do a fantastic job out there. It's amazing. They did last year almost 2,000 spay and neuter surgeries, and they do low cost spay and neuter surgeries for people that can't afford to get their pets spayed or neutered. They could bring them in. They host special clinics for that. They did 815 intakes last year, 543 adoptions, just a huge number of animals go through there. They currently have about 100 cats, and that's typical, and about 30 dogs. And that's a typical number of cats and dogs for them. 96% save rate. So it's considered a no-kill shelter. The only animals that are put down are dangerous animals. So they do a fantastic job. So I just wanted to kind of give a shout out to them and Director Tillotson for the work that they do in the HATS leadership. The other thing I attended was an event at CMU, LGBTQ plus forum called Shaping LGBTQ plus Policies in Michigan. And they talked about the history of the Elliott Larson Act and the efforts to expand that and the recent success in expanding that to cover sexual orientation and sexual identity. One of the panel speakers, there were 4 of them, Jeremy Moss from the Senate, Frank Foster, a former congressman from the UP, Jack Day, who's a House of Representatives person from Kalamazoo area, and Dana Nessel was the other speaker. And the whole underlying message was that Michigan needs to be not just a safe place for everyone, but a welcoming place and a place where people can flourish, a place where our young people will want to stay. So great event. So I just wanted to talk about those things, and that's all I have. So any other announcements? Seeing none, is there a motion to adjourn? It's been moved and supported. All those in favor say aye.
Aye.
We'll come back in about 10 minutes.
Find that.
12 maybe. Oh, we're adjourned.